Hey guys, well, coronavirus, North Carolina. Um, Today a news report has come out. Let me switch this over real quick. Today a news report has come out, and the NC governor has confirmed the first case of coronavirus in North Carolina. The disease caused by coronavirus that has slowly started to spread to the United States. Governor Roy Cooper's office reported this Tuesday. A Wake County resident recently traveled to Washington State and was exposed to at a long-term care facility where there's currently a COVID-19 outbreak. Cooper said at an afternoon news conference. He said that the person, who was not identified, is doing well and is in isolation at home. We've been preparing for this, and we do not expect to see more cases in North Carolina, the governor said. Cooper said local health department officials are working to identify who else may have been exposed to help contain the spreading. I know people are worried about this virus, Cooper said, and I want to assure you the state of North Carolina is prepared. Our most important work is keeping people healthy and safe. An isolated case. Cooper said state officials are also working closely with local health department and healthcare providers to quickly identify and respond to new cases. Health officials say this is an isolated case, but they are continuing to monitor returning travelers to help prevent the spread. Now, this is the area here. This is Wake County. I'm down here, but this is Wake County area here. This is Wake County. Dr. Manny Cohen, Secretary of State Department of Health and Human Services, said the individual flew home to North Carolina but did not say which airport the person flew from or into. Neither did officials share information about which healthcare facilities the individual may have visited or where in Wake County the person resides. Cohen said they're starting to trace the immediate contacts that the infected person would have had, including informing people on that flight. Chris Kipps, the Wake County Director of Public Health, said they are contacting the individual at least twice a day to ask how they're feeling. The person is taking their own temperature and giving health officials specific information to monitor their health. The person will remain in isolation until they no longer have symptoms and produce 2 negative tests that are 24 hours apart. Dr. Elizabeth Tilson said at the news conference she is the state health director and chief medical officer with North Carolina DHS. North Carolina testing just started Monday. State officials have been identifying potential cases since late January, all of which have been negative. But the state lab started testing cases Monday, which is how they identified this first case. It is a presumptive positive case because it is only the second day that the lab has been doing that testing, Cohen said. The samples from the individual are sent to the U.S. Centers for Disease Control and Prevention for confirmation, which could take about 24 hours. Cohen said the state will do confirmation tests with the CDC for a while, but it is good news that the state has the capacity to do more testing itself because it can get results faster and respond faster. North Carolina will continue to see additional cases among travelers and people who have had contact with someone who may have the infection, and the state will continue to monitor more individuals, Cohen said. And about 80% of the coronavirus cases, people experience mild symptoms, and the mortality rate is about 1.4%, Tilson said. We anticipate that the mortality rate might actually be coming down the more we learn about the virus and more people that have mild symptoms, Tilson said. So far, they're seeing that older people with underlying health conditions seem to be at a higher risk, and children seem to fare very well. Only about 1% of the cases have been identified in children, according to Tilson. Steps to stay safe. Cooper said the most important steps North Carolina residents can take to stay safe are to wash your hands often, avoid touching your face, cover your mouth and nose when you cough or sneeze, clean and disinfect surfaces, and stay home from work or school if you're sick. The CDC's website shows 60 cases in the 12 U.S. states as of Tuesday, and a total of 6 deaths. However, media reports Tuesday afternoon said 9 deaths have been confirmed, including some that occurred last week but were only now connected to the coronavirus. Dr. Tedros Adhanom, I can't pronounce the last name, Director General of the World Health Organization, said in a media briefing Tuesday that there are about 90,893 reported cases of COVID-19 globally and 3,110 deaths, according to the transcript of his remarks on the WHO website. In the past 24 hours, he said China reported 129 cases and fewer cases since January 20th. Outside China, he said 48 countries have reported 1,848 cases of illness, 80% of them in 3 countries, South Korea, Iran, and Italy. We understand that people are afraid and uncertain, Ghebreyesus said, according to the WHO. Fear is a natural human response to any threat, especially when it's a threat we don't completely understand. But as we get more data, we are understanding this virus and diseases it causes more and more. Local hospitals have been getting ready. Area hospitals and healthcare systems have been trying to prepare for the arrival of COVID-19. On Monday night, UNC Health CEO Wesley Burke sent a note to all employees describing some of the preparations, which includes setting up a group to oversee the work system-wide. Burks noted that UNC has several internationally known infectious disease experts who are consulting with the healthcare system and consulting with local, state, national, and international health officials. UNC Health also is working with CDC, Burks said. With the first confirmed cases in North Carolina, UNC Health and its individual hospitals are closely monitoring developments and continue to make preparations for the range of scenarios, he said. UNC Health and its entities are well prepared to treat any patients we might receive while also minimizing disruption to our normal operations. A spokeswoman at Duke Health said all 3 of the system's hospitals have spent weeks planning and preparing for local eventual cases of coronavirus and are ready to manage cases that require hospital care. Anyways, you guys, there's more to this article, and I'm going to leave this article below the video. A few minutes ago, I just received a call from my daughter's school alerting me that while there are no known cases at my daughter's school, and I'm going to put this out there for anybody who has children, if your child is sick or has a fever, do not send them back to school until their fever is gone without Tylenol for 24 hours. Remember, when you're out anywhere, to touch anything, wash your hands. That means, like, when I went to go get my medicine, even though it's coming through a drop box, afterwards, I have some hand sanitizer. I cleaned my hands before opening the bottles, okay? That way, I'm not carrying any diseases from anywhere somebody else has touched. Yesterday, I went to my doctor's office and I had to use a pen to sign something. Right next to it, which is good practice, is hand washing liquid. Everybody touches that pen, so you should clean your hands after using the pen. After you go to a doctor's office, it's good to wash your hands anyway, regardless of whether you're there. You can wash your hands in a sink while you're in the doctor's back room, like, the little rooms they put you in. They generally have a sink in there. Wash your hands. Just remember, anywhere you're at and anywhere somebody else can touch leaves germs. Doesn't matter if they're sick or they have it. You're going to pick up germs from somebody who was. So always wash your hands. Don't touch your face and don't put your hands in your mouth. Especially if you're going to go eat somewhere, wash your hands before you eat. If you touch a door, clean your hands. It's one of those things that'll help keep everybody safe, is to practice all the clean things that you were taught when you were growing up. How to wash your hands before you eat, how to wash your hands after you go to the bathroom, how to wash your hands when you're getting ready to prepare food, when you're doing anything. Just observe cleanliness, and that's very important, is to observe cleanliness. Anyways, you guys, I'll keep more updates on here, and I'll continue to do updates as they come in and I find new articles and stuff. Also, California right now is having some wildfires again, so it's something I'm going to be keeping an eye on. They got some bad wildfires going on right now. Also, you guys, below my video, I'm leaving a PayPal, and if y'all would like to help, it does help me out. I'm going through some bad times right now, so it is very much appreciated. Anyways, you guys, much love. Be good to each other and be good to yourselves.